Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is conducting a new patient assessment with a patient who has self-referred for treatment of her panic attacks. The patient relates that she has had anxiety for years and that she has episodes during which she gets very agitated, she can feel her heart pounding, feels as if she cannot breathe, feels very shaky, and has to sit down and wait for it to pass. These episodes can last for more than 15 minutes until she starts to calm down. Which of the following is inconsistent with diagnostic criteria of a panic attack? A, the duration is too short. B, the duration is too long. C, there is no report of worrying in between episodes. Or D, there is no report of intense fear. So again, this is assessment/diagnosis question. You're gathering information to support a diagnosis. When you look at these answer choices, one thing worth pointing out, there's an old saying when you're answering multiple choice questions that if you have two answer choices that are opposites, chances are the correct answer is one of the opposites. But it is an old saying, and people that write questions, they hear those old sayings too, and do try very hard not to fall into those patterns. And this is one of those times where you really can't go anywhere with it because, well, you have duration too short and duration too long, but then you have no report of this or no report of that. So you really do need to know what constitutes a panic attack. And this is a very common question clinically. People will ask you, what's the difference between an anxiety attack or a panic attack? And I guess number one, an anxiety attack is not really a recognized criterion phenomenon in mental health. It's a lay people term. An anxiety attack is whatever somebody thinks it is. But a panic attack does have criterion, and it's important to make the distinction. Not everyone who thinks they're having a panic attack is actually having a panic attack. So it is important to know the criterion. So as we look at these four answer choices, the correct answer is D. The question is asking for criteria of a panic attack. A panic attack is a symptomatic episode with distinct characterizations identified by the DSM. It's characterized by any number of physical symptoms, including all of those described in the question. The bottom line is that there needs to be at least four. And I'll run through the entire list in a moment. But the patient needs to have at least four physical symptoms that are identified by the DSM. And this patient does. But the other distinction is that a panic attack requires a cognitive symptom. And the cognitive symptom is very specifically some very intense fear. Fear of dying is very common and very typical. And if the fear isn't of dying, it should be something like some equivalent imminent catastrophe, like, I don't know what's analogous exactly to an intense fear of dying, but a very intense cognitive fear, like that the world is going to end, or that there's going to be an explosion, or that the patient is imminently going to be attacked, for her life or his life. That intense fear is a very distinct cognitive symptom that is separate from the physical symptoms. That's what constitutes a panic attack. A minimum of four physical symptoms, and then one cognitive, intense fear of something. That's what needs to be there, and that is not described in the question. The patient doesn't describe an intense fear of anything. Everything described in the question is very physical. A and B are not correct answers here. This 15 minutes is not too short or too long. Panic attacks can last up to an hour, but typically are said to peak at about 10 minutes and then begin to wane. So a numerical criterion, a time limiter of 15 minutes is consistent with a panic attack. Um, Now, C is not the correct answer. There is no report of worrying in between episodes, and that's not an issue with a panic attack. Now, with panic disorder, C is a diagnostic criterion. And that's the other thing that we need to pull out of this question is recognizing the difference between a panic attack and panic disorder. They are two distinctly separate phenomenon. If you've ever tried to add an ICD-10 code for panic attack in your medical record, you probably got 15 red exclamation points that said, "This is not a diagnosis. This is not a diagnosis." And it's true. It is not a diagnostic criteria for a condition, but panic attacks are distinct symptoms. So, I guess to make a long story a little bit shorter, a panic attack is a single episode where the patient experiences, at a minimum, 4 physical symptoms. They can include the pounding heart, the palpitations, breaking out in a sweat, acute onset physical, trembling, shaking, shortness of breath, chest pain, nausea, vomiting, derealization, chills, like all of those physical symptoms. There needs to be 4. But then there also needs to be at least one cognitive or psychological symptom characterized by like an intense, imminent, something bad is going to happen. That's what makes a panic attack. And that's what the question is asking you about. Now, panic disorder is a diagnosis that is characterized by recurrent panic attacks, but there's other criterion. In panic disorder, the patient has them for a minimum of 1 month, that they are not triggered by any obvious identifiable thing. They could happen out of the blue. And in between episodes of panic attacks, there is worry about when the next one will occur. So we've got 2 concepts embedded in this practice question here. One, the distinction between a panic attack and panic disorder. And then number 2, what is a panic attack? Because that's what this question is about. What constitutes a panic attack? And what constitutes a panic attack are at least 4 physical symptoms and the 1 intense cognitive symptom. And that's how we come up with D as the correct answer to this question.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.